House Republicans who voted dozens of times to repeal the Affordable Care Act have finally unveiled their plan to replace it. The GOP proposal does not require health coverage. It relies on tax credits to help people buy insurance. It's still unclear how many people will be included in the plan and what kind of coverage will be available. Nancy Cordes is on Capitol Hill, where two House committees plan hearings on the legislation today. Nancy, good morning.
Good morning. This is a major milestone for Republican leaders who had been fending off questions about whether they could even craft a credible Republican alternative to Obamacare. However, there are still some key details that are missing, like the cost of the plan, because Republican leaders rushed to get this bill out before some of the number crunching was done. The Republican bill eliminates many of the main tenets of Obamacare, including the individual mandate, the employer mandate, and most taxes. In their place, a dramatic expansion of health savings accounts, plus refundable tax credits for low and middle-income Americans who don't get insurance through their work. Republicans say the credits would range from $2,000 to $14,000 a year, depending on age and family size. Oregon's Greg Walden is one of the bill's authors.
We're like the ambulance crew that showed up at the scene of the wreck. We're here to clean up the mess and heal the patients.
His bill preserves Obamacare statutes that protect people with pre-existing conditions and allow young adults to stay on their parents' plans until age 26. The bill would wait until 2020 to scale back Obamacare's Medicaid expansion. That's a concession to GOP senators like Ohio's Rob Portman, who opposed an earlier draft of the bill that cut Medicaid more aggressively.
This would have been very difficult for us and for a lot of people who right now are getting coverage under expanded Medicaid for things like drug treatment.
The question now, can GOP leaders win over conservatives who want deeper cuts to Medicaid and oppose the low-income tax credits? Without their support, the bill will go nowhere. Walden says they should be happy with the changes.
We're repealing and replacing Obamacare in what will be one of the biggest entitlement reforms since Bill Clinton was president, and the reformed welfare.
We should know fairly quickly whether Republicans of all stripes are going to rally around this plan, and some of them are predicting that there will be some pretty major changes before everything is said and done. Democrats, Norah, are already slamming the bill. They say it provides much less assistance than Obamacare, especially for low-income Americans and older Americans, and they predict those people will no longer be able to afford insurance.
Nancy, thank you.